Fikadesilasse. I'm so happy to have you here on the Everyday Leader podcast. I'm always excited about all of my guests, but you are very special because I've known you for a very long time. You are quite famous, and for a good reason, because you're one of the very talented, smartest doctors I've ever known in my life. And I'm so grateful for to have you here. So welcome to the Everyday Leader.
Thank you so much, Dr. Anane. You are so generous, and I really appreciate it. So, especially this endorsement coming from one of the brightest orthopedic surgeons Ethiopia has produced. It's a big privilege for me to be introduced in such a way, even though I don't think I deserve everything you mentioned. But I really appreciate it. It's very kind of you. Thank you so much for having me here as well. It's quite a privilege. I appreciate it.
Thank you so much. Who is Dr. Fikadesilasse Henok before you became the man of impact that we know now? So tell us your story, the origin story.
Thank you so much again. I don't know if I am a man of impact yet, but if you say so,
Yes,
we
you
would
are.
like to accept it. And Fakada Selassie, I'm not that complicated. I mean, I have gone through a lot of training in different specialties, and also through the years, I have done quite different things in life. But before I became a physician, definitely as any boy who was born and raised in Ethiopia, I was like, doing the usual stuff, nothing out of the ordinary. But eventually, I decided to join, medicine. The first thing happened was like, after we finished 12th grade, I joined the Faculty of Natural Sciences, or at that time it used to be called the Faculty of Science under Addis Ababa University. It's physically located at Arat Kilo. Most of you are familiar with it because if you choose the natural science pathway, then you will be assigned to those institutions where natural science is given. So one of them was Arat Kilo, or the science faculty. So I joined there. So I did freshman, so the basic stuff. And then after freshman, based on our freshman grades, we have to pick, departments. And I chose medicine as number one choice. And I joined the Faculty of Medicine at that time. So we had to stay second year at Arat Kilo doing, pre-medical courses. So I spent 2 years at natural science faculty, and then I joined medicine. Then I became a medical doctor, like anybody else. Okay. So then I was fortunate enough to get the opportunity to be recruited as a faculty, and we were the first actually. Only the five of us, my dear friends. If I mention them, you know them by name. They are still part of faculty at Addis Ababa University, and two of them are abroad. Three of us are abroad, two of them are still in Ethiopia. So the five of us, we get the privilege of being recruited at the first ever GPs to be recruited in the history of Black Lion, or
Oh,
the
wow.
Faculty of Science at that time. We were fortunate. It's just luck. It's not because we were special, but the university decided to recruit, from GPs that year. So we were the first batch when they decided. So I was fortunate. I got the opportunity, I grabbed it because, like, I was always passionate about becoming an academician. So at that time, Addis Ababa University was not recruiting academicians, right? So I was eyeing some institutions. I remember at that time I interviewed with Mekelle University, and I was about to interview with Hawassa Medical Faculty at that time. But this opportunity came, and like, oh my God. So I was fortunate, I took it. Originally I'm from Addis, so I didn't want to be away from my family as well. So I stayed there. So it was fortunate. Then we were given the privilege to go ahead and do postgraduate training right away. So we didn't waste time. So it was only 1 year in transition that we missed. That was because when we graduated, it was already January, and the academic year starts in January, as you know, and our appointment was not effective right away. It was effective as of May, I think. So we had to wait until the next cycle comes. So then I joined general surgery. In between, I was also recruited as a GP by the Tukur Ambassa Hospital. So at that time, Tukur Ambassa Hospital, And at the Ababa University Faculty of Medicine, their administration was completely separate. So for a couple of months, I was not part of the academic environment, but for a few months, I worked as a GP for Black Lion Hospital, and basically I was working in the outpatient department for general surgery. Then general surgery residency got started, so I did that for 4 years, and then immediately when we finish, I will give the credit to Dr. Baeda. Dr. Baeda, yeah, is a urologist, a well-known urologist, and he was a department head. He talked to the three of us, and I mentioned to you earlier. So the three of us joined the Department of Surgery out of the five who got the chance to be recruited as an academic staff. So he sat down for a mini meeting with the three of us, and he said, "You guys are young. My vision for the department is for you to do fellowship in the subspecialty of your choice, so that I want you to be leaders of the future, I mean, in a department." Then we said, "Hey, yeah, I mean, that's what we want. I mean, you are young, energetic, you want to do something different." So myself and my best friend, Dr. Ayaleo, we chose cardiothoracic surgery. So immediately within a month after we graduated from general surgery, I think it was 2 or 3 months in between, then immediately we started fellowship. We were fortunate. And my best friend, my dear sister, Dr. Tetana, she picked pediatric surgery. So she also started pediatric surgery subspecialty. So the three of us immediately, it was kind of a virtual training. I mean, a vertical training. We didn't waste time. So immediately we started our subspecialty or fellowship training. At that time, fellowship was not really not well known. I mean, yeah, there are our teachers. They had to go overseas, abroad, do their fellowship, come back and practice in the country. So these fellowship trainings were just coming up. They were getting started. And the Department of Surgery was one of the leaders to start fellowship. So we were enrolled, myself and Ayale, we got enrolled at the second batch of cardiothoracic subspecialty training. So then I studied that for about 3.5 years, became cardiothoracic surgeon, worked there for about 2 years and a half, probably, after graduation. Then life happens. Fast forward, I decided to move to the US. And then after I moved here, then I have to, figure out what I should do as a career path. Obviously, I have to continue practicing medicine, but which specialty, I had to take my time and reflect on myself, and I had to make a decision. And I made a decision to pursue my training in internal medicine because it was kind of easier. It takes shorter duration and all that. When you are very young, energetic, ambitious, when I was as young as I was a GP, you are always adventurous, taking adventures. You always want to pursue only your career goals and all that. But, when you grow older, a little bit of maturity comes, then, you try to be as practical as possible. So, yeah, I could have done general surgery and then, pursue a training in cardiothoracic surgery. It may not be easy, it may be competitive, but if you are determined, you can achieve it. You know what I mean? But I sat down with myself and thought about it. It might take me about 8 years to accomplish that. And minus the preparation for the USMLE examination, right? So if you take 1 or 2 years, it took me almost 2 years, a year and 8 months to finish all step 1, step 2 CK, step 2 CS. At that time, it was a step 2 CS, not the OET exam for English. So it took me around a year and 8 months because I had zero preparation when I moved to the US. I have never seen any of the materials which would help you prepare for USMLE. So I was novice to it. So it's just fresh start. So it took me about a year and 8 months. And there are also other responsibilities in the background. So it is not easy, So take that one, it takes 2 years. And then the application process by itself, it will take 1 year. Because you apply in September, and it's going to be an interview season, and then a matching comes in March. So the academic year starts the next year in June, July, actually, technically in July.
Wow.
So it will be 3 years total, right? So 3 years plus 8 years, 11 years. Do I have that time? Do I have that luxury? And, I have done a lot of training, almost 16 years of college training in the background. So, you get fed up to a certain extent. So I had to be realistic. So I said, okay, why don't I do internal medicine? And if I am tempted to do any subspecialty, I can still do some specialty which is somehow related to cardiothoracic surgery. I can do cardiology or critical care and pulmonology or GI. That was in the background of my thought process. So I picked internal medicine. As I predicted, it was not that challenging. I matched during the first attempt, thanks to God. I'm fortunate. Now looking back, when I see people struggling, I could have been one of them. You know what I mean? I was fortunate. I did it the first time. But what if I didn't? It could have been really frustrating. You know what I mean? So, but I was fortunate. I will give the credit always to God because I don't think I'm like, special person. But you work hard, but at the same time God has to bless it. I see it that way. So I give the credit to God. I was fortunate. God helped me. It happened. I matched the first time. So I did 3 years of internal medicine again. So now I'm working I'm practicing as an internist. I'm a hospitalist at this moment. But in the process, when I mentioned it took me almost 16 years to become a cardiothoracic surgeon before moving outside of Ethiopia, I had the opportunity to practice other places. So I went to India in one of the very big institutions in Tamil Nadu. Most people might be familiar, especially people from India. The majority of the physicians are familiar with this place. It is named Christian Medical College Vellore. It's found in a city called Vellore. It's about 2.5 hours from Chennai. Many people know Chennai. It's a big city. So it's a great institution. It's always ranked either number one or number two throughout India. So that also added value to me. I stayed there for 6 months, and the majority of the attending physicians are trained overseas and they come and practice in that institution. So it was a big addition. And the other experience I had was like, I had to travel to Sweden as well and stayed there at an institution called Sahlgrenska Medical School. It's a teaching university. It's located in Gothenburg, Sweden. So I stayed there and studied cardiac surgery in there as well, lung transplantation, cardiac transplantation, and all other sorts of open heart surgical procedures in there. And I was also fortunate to function as a visiting professor in Karolinska Institutet. Karolinska Institutet is a big name. They give Nobel Prize in medicine and physiology. So back in 2015, I was there as a visiting professor and I taught general surgery for residents and medical students. So it's quite a journey. So I was fortunate. God blessed me. God blessed my journey. So I had all these opportunities to grow in medicine and acquire all these skills and knowledge. So in short, this is Fakadesilasse.
Wow. See, this is why I didn't want to do the introduction because what do you pick and what do you leave? Like, it's so confusing because you've got such a like deep and then important, no point can be missed out. Quite an interesting journey, to be honest, and it just shows how resilient you are. Because it's not easy dedicating your life for healthcare for medicine for this long, and then each step in your life it's kind of like starting over and you're still not discouraged and you kept going, so that is so inspiring. So those steps you've mentioned, they're not easy, and I don't think anybody can do it on their own. So have you had any mentors along the way? Because I know you do a lot of mentoring now, from the place you're at, but have you had any mentors during any of this time period of your life?
The answer to this question is gonna be a little bit complicated. I wish it was straightforward and simple to answer. I wish I could say outright yes, but unfortunately, I'm gonna say no, and at the same time, I don't want to take away credits from certain individuals as well. I mean, growing up, I want to give credit to all those individuals who taught me one way or another. Back in time when I was an undergraduate medical student, all the instructors in Blackline, they were amazing. They taught us, they worked hard, they were always available to teach us. So I don't want to take credit away from them. So I give them big credits. I do respect all of my teachers in every department, to be honest with you, starting from the pre-medical sciences up to the clinical sciences. But at the same time, did we get the chance to have a one-to-one mentor? The answer is gonna be no. During general surgery residency, there are many people who had an impact in my career. I can mention some of them, but I don't want to disappoint the rest, because everyone in the department has played a certain role in my advancement as a surgeon, and I appreciate all of them and I give them credit. But always, like, certain individuals will stand out, right? So if you go unit by unit, probably, from general surgery, I would give high credit to Professor Brahano Kotiso, because he was always available to us. When we wanted to do certain complicated surgeries, like, gastrectomies, APR surgeries, as a fourth-year, third-year general surgery residents, he was very eager to teach us. He was always available. He comes to us. And I remember one time I had a person who presented with perforated gastric cancer. And I thought it was a simple perforated PUD, but it was a perforated gastric cancer. And he was around, and I asked him, can you help me? He said, yes, of course, I am here to help you guys. And I want to help the patient. I want to help you advance your skills. And he came, and then, I was just asking him, are we going to do some sort of a patch, or what are we going to do? Then he said, do you think I am here to do just an mental patch? No, we are going to do, gastrectomy. Go ahead, do it. So he was there. I was encouraged. I know to a certain extent how to do it. He was there. He was guiding me. We did it. So he was always available. So, those kind of people, you cannot really take the entire credit away from them. And Professor Tasamma, since from the undergraduate year, we had a very pleasant relationship. We still keeping in touch. He mentored me. He gave me advices, guidances, and all that in many occasions. So that's the reason why the answer, I cannot say no, and I cannot say also 100% yes, because some of the mentorship may not be continuous and in a form of a formatted way. You know what I mean? And then when you come to cardiothoracic surgery, then, I would say Dr. Daraja Gululat was very impactful in my life. Actually, Dr. Daraja Gululat had an impact on me since undergraduate years. And he was one of them who guided me in picking also general surgery, because I had this dilemma, you know what I mean? So people think I could be an internist, I could be a gynecologist, and I could also be a pediatrician. And mainly because they see you work hard during your internship. I get all A's in all of the 4 departments during internship. So the residents, they would say, you should be a gynecologist. A gynecologist resident would tell you, you should be a gynecologist, you're good at it. And then the internist would say, you should be an internist, you will be fantastic. And the surgeon would say the same thing, and the pediatrician the same thing. So I was kind of confused. Oh my God, what am I gonna do? Because you are kind of pluripotent, right? You can differentiate in any way you want, because you are novice, you haven't committed to anything yet. So it was a tough decision. Then I had to go to Dr. Daraja Gululat. He took his time to talk to me and guide me and show me the reality. And he cleared out my doubts related to surgery and all that. So I was confident to make that decision and join general surgery. So he was my mentor. So I cannot say there was no mentor at the same time. And during cardiothoracic also, I used to work with him, both in Blackline and as well as outside, We used to operate together at Tazana, especially over the weekends. So that was impactful. The way he talks to patients, the way he handles his patients, his kindness to patients. The same thing with all of the other professors as well. So they put an impact knowingly or unknowingly, because you watch them, how they communicate. You see them, how they handle patients, how they take care of their patients. So indirectly, they were my mentors. And Dr. Siyum Kasa was very kind, very approachable person as well in cardiothoracic surgery. So we have done many surgeries with him. He guides you. We had a very good interaction, both in hospital, outside of the hospital. So he was very kind to us. He was guiding us. So these people are really, one way or another, they were my mentors. But was there any dedicated mentorship? And there was a dedicated person who would be invested in you and guides you throughout your steps? The answer may be no, but at the same time, these people, they were really instrumental. So mentorship is key, especially when you come to the US. You see how a mentor can really shape your future. If you have an excellent mentor, you will have an easy path, to be honest with you, because they direct you, they kind of guide you, they tell you the pros and the cons and all that. So when you are challenged, they are working with you to solve those challenges. So it means a lot. It means a lot. So I believe in mentorship. So there are certain times where I was frustrated because there was no person for us, I mean, to be 100% committed so that we achieve our goals. Even though I mentioned all those great, physicians back home who helped me one way or another, there were also moments in my career path where I was really frustrated because, you know, we were not achieving our goals the way we wished to achieve them, especially in establishing a continuous cardiac surgery care in Ethiopia, because we didn't fail. I personally didn't fail as a person. I achieved my goal. When I picked cardiothoracic surgery, people were laughing at me. What are you planning to do? Because there was no cardiac surgery center at that time. I was an undergraduate student, and the Children's Heart Fund was not there. People came to lay the groundwork for that institution to be built. At that time, I was passionate about becoming a cardiothoracic surgeon, and people laugh at you. Where do you want to practice? No one is doing it. Where are you going to do it? My answer to those challenges was like, I am young. I am not yet a cardiothoracic surgeon. It's a process. It takes a while. While I am learning, Ethiopia will have the capacity to allow me practice it. That was my motto. So I pursued my dream despite all the odds, but at the same time, the system kind of failed us. Certain individuals also failed us. I'm not here just to blame others, but somehow we were failed. And you can see that even until now, I know that a lot has changed. Many people have trained in cardiac surgery, and they are doing a fantastic job. And I'm so happy there is still folks out there doing the actual work on the ground. I'm happy, I'm proud of them. But at the same time, as people who were pioneers in the forefront, we achieved our goal. But was the mission accomplished? The answer is going to be no. And part of the problem was a lack of a mentor, or lack of an advocate, actually. Probably I'm waiting for some other time to express what I'm trying to say right now. I'm not telling you the entire the entire reality, but there were moments where I was really frustrated and heartbroken because we couldn't advance what we wanted to advance. So that is a sad part. That needs to change. That needs to change, and that is the reason why I try my best to open opportunities for other people, because there were individuals who closed the gate on us. There were, as much as there were individuals who opened up the gateway. I mentioned Dr. Bada. He opened the door for us real big, because if he said, no, you guys are fresh, I want you to work as a general surgeon for 5 years, only then you can ask me about subspecialty. He could have said that. He didn't. That's why I gave him a big credit. I love Dr. Bada, by the way. He's a kind soul. It's not only for me. He opened the department's door for many individuals to pursue their subspecialty training. So that propelled us forward. And then when we were about close to the finish line, there were other obstacles. And you will be surprised if I tell you the entire truth. So that was frustrating. That needs to change. That has to change. The new generation should get the opportunity to get trained. They should get the opportunity to practice what they want to practice to help their nation. So I think, people who are listening to this, they should really pay attention. And I want to be part of the solution. I'm not gonna be blaming it on others, because some people might say, why did you leave the country then? I mean, like, if you are so passionate. And I can tell you many reasons why I did that. But that is not going to be a solution. I love my country and I love my institution, and I want to give back. And I am trying my best. I am not sitting idle. I'm doing many, many important things in the background without being noticed. So I believe in that. And I hope things will change. So mentorship is complicated. Yeah, there was no formal mentorship, but one way or another in the process, I had mentors. And I am so grateful and I am so thankful for all those individuals who helped me to advance my professional career. I'm always grateful to your contributions.
Wow, that is so interesting. You are right. I think part of it, for me, how I understand it is they never had mentors as well. Like most of our teachers, right? Like mentorship is not a thing in Ethiopian educational system, which obviously has to change because now in the U.S. you can see even at the level of high school and even lower than that, they would have like career days where people come out and explain to them what being a lawyer is or a firefighter is or something, so that they can have an understanding and expectation of what are potential careers for my future, and kind of directs their focus even while they're in school, let alone going in higher institutions. So mentorship is quite critical for change to be sustainable, right? Like you said, somebody opened the door for you, but if there was someone to carry you through those challenging times, you might have made a bigger impact than you already have, and you already have made an impact, but it could have been way bigger and obviously more sustainable. So you're right. This toxic culture of resetting, that's what I call it. We reset. A batch comes, you'll have great people, and then those great people don't have access on resources that they need to do what they have to do. Then obviously life happens, they have to move, and then it's a reset. Then we have to wait for the next batch of people who are willing to do something. So it's like starting from zero every single time, and really that's just such a waste of human resources. And we're still seeing it today, even worse now because of the brain drain. This, how many people have left in the past, what, like 5 years, a decade? A lot of people left the country who has had great potential. So mentorship is really a solution to a lot of the issues. Thank you for that point. And I'm glad you're doing it. You're, paying it forward now by mentoring others, because it's really important. We see a lot of young people giving up. You've seen what's been going on social media. Even if you're based in the US, you still see what has been happening. So I'm thankful that you're doing the things that you're doing on social media, and even in the background, which we will come to later on. So let's go back to your transition from being a cardiothoracic surgeon in Ethiopia to being a certified, a licensed internist and practicing at the US. What were the things that shocked you when you first started working in the US? Not even the process. I understand even that is difficult, but once you started working, because a lot of people think, let me just get through the steps, step one, step two, and sometimes some people might need to do step three, depending, but everybody understands that challenge, but they're hoping that once they become a specialist, once they come, once they finish their training, everything is going to be okay. But what were the things that shocked you when you first started working in the US versus how it was and your experience in Ethiopia?
It's a very beautiful question, by the way. But before I address that one, I want to add a few things on the mentorship aspect, because I have forgotten certain key individuals
Go ahead.
who had really played a lot of role in my career. So number one, I wish him to rest in peace. May his soul rest in eternal peace. It's Dr. Fikru Maru. I hope you know him. He is the founder of the Addis Cardiac Center, which is located around Bole Mikhail region. And he is a very renowned electrophysiologist who has been practicing in Karolinska and other places in Sweden, Norway, and all that. So he was a kind soul. I mean, how can I forget mentioning about him? Dr. Fikru doesn't know me in person. Let me tell you, he doesn't know Fikadesilasse. But Dr. Bakala Alamayo, the cardiologist from Black Lion, we were very close because he knows me from undergraduate years. So I was very close with my teachers. I respect my teachers and I am close to them. I'm not scared of them. And I encourage you, young individuals, be close to your teachers. Be respectful. Respect them. The way you should respect them, and you should respect them, and at the same time, don't be scared of them. They are like human beings. If you are interested to learn, eager to learn, advance, people would be interested to help you. We are approachable. From distance you are scared of us because most of the time we are hierarchical. You know what I mean? That's the downside of it. So Dr. Fukru doesn't know me in person, but Dr. Bakala does. So Dr. Bakala told him that I am a young aspiring cardiothoracic surgeon, and he told him that I have a potential in the future. So then Dr. Fikru told me to come and work with them at Korea Hospital. At that time, they didn't have their own operating theater, so they were kind of leasing the operating theater at Korea Hospital, and open heart surgeries used to happen at Korea Hospital. So they invited me to join them there and assist in the procedure. So I had to work long hours in Black Lion, and then I have to go all the way to Korea and then join another surgery. That's whatever it takes, I have to do it. And I am young, energetic. I was aspiring to do all the good stuff to the nation, and many people are waiting for us. So I was eager. I was never tired. So I went there. Then even the first day, I already started working with the team coming from Sweden, and Dr. Fikru still doesn't know me in person, even after I joined the team. And one day we met. We met for a few minutes because I was in the middle of surgery. They called me. They came. They were just in the waiting area. He said, "Hi, okay, Fikadesilasse, nice meeting you. How are you? How's it going? Do you like it?" Yeah, this kind of stuff. And we kind of briefly introduced to each other. He left. Then guess what? Like, the team left within 2 weeks or something. I was like attending this postgraduate diploma course with the University of California, San Diego. I forgot to mention that. I did clinical research methods for 2 years as a postgraduate diploma with the UCSD, or University of California, San Diego. And I did it while I was doing my cardiothoracic surgery fellowship side by side. So at that time, I was just in the middle of that course at one of the hotels around Bole region. Then I got an email. Boom. And that email was from the late Dr. Fikru Maru. What a kind soul. So it is an invitation for me to travel to Sweden. That is how I ended up in Sweden last time, to do the fellowship, part of my fellowship in Sahlgrenska. So we had a great mission with him. Then he sent me there. Not only that, all my expenses, my stays, and everything has been covered by the department there. But at the same time, he sent the professor money to give it to me.
Really?
How much was it? Like, so certain thousands of Swedish kroner. So the professor, who was my focal contact person, called me. I was in the OR. Then I said, "Hi, Professor." His name is Lars. "Hi, Professor Lars. How are you doing?" Then he said, "Okay, do you have time? Can we have dinner tonight?" And then I said, "Why not? I mean, it was a summer month. It doesn't get dark so fast in Sweden." Then I went there, we had dinner, and then by the time I was gonna say bye-bye and I was about to leave, he was gonna give me something in a post and rolled up, and he said, "Take this. What is this?" And then he said, "It's what Dr. Fikru sent you." What did he send me? And I think it's money. Then I opened it, it's money, and I put it back in the table. No, I'm not gonna take this money. The opportunity is enough. I don't have expenses. I have a certain, daha kuruna ይባላል አይደል? In Amharic, daha ቀብራራ ነው. So I had a couple of how much euros did I have? I had a certain amount. You know what I mean? Then I said, I have enough money. I have money with me. So and all the expenses are covered. So I don't need the money, and I am not gonna take it. So the professor was a little serious. Then he said, "No, you have to take it because sent for you, and I have to give it to you, and you have to take it. If you want to return it, talk to him. Now take this. Then I took that on. Who would do this? Imagine he gave me the privilege
That's amazing.
to join the team. Not only that, he arranged it for my invitation, so the visa process and everything was seamless, and I had to go there, everything covered, and he sends me his personal money. Who would do that?
Wow.
So that is the reason why I said, if you have a great mentor, then you would the sky would be the limit. And I would say Dr. Fikru was my mentor. I should give him this credit.
Literally.
Unfortunately, all the many unfortunate things happened to him. As you know, he was in prison for some time and all that. So instead of me traveling to India, we were working hard to transfer all my training to Sweden, because I had a very good relationship. They liked me. They wanted to give me the spot. So he wanted me to stay for a longer time. So that 6 months period, I could have spent it in Sweden. And like I said, unfortunately,
Mhm.
all the unfortunate things happened. I feel sad for him. So because
Mhm.
of that, those opportunities couldn't get materialized. Even then, when the cardiac surgery service started in asthma, I was the one who brought the sketch for the operating
Yeah.
theater.
Wow.
And because, like, one of the surgeons, he specifically wanted things to be done the way they wanted. So I had that sketch. He was telling me how to, kind of follow up on things. Of course, the institution follows it, but at the same time, representing the team in Sweden, I was also, getting involved to a certain extent. So that operating theater got accomplished. We operated in it. I was participating for how many times? 2 or 3 times. It was progressing well. But the thing is, like I said, if you are not supported in all the different meanses, by all the different meanses in all the different places, you wouldn't succeed. You will be destined to failure. So, some things were not going the way they should. So I'm talking about the way things were going on in my home institution, not with asthma. But Dr. Fikru should be given the credit, and all the surgical team in St. Paul, including Dr. Girmay, Dr. Ayelling, Dr. Zagana, and other people. I forget some of the names. Dr. Aster, all these great surgeons at St. Paul Hospital, because St. Paul Department of Surgery was affiliated with the Tukurambasa Department of Surgery back then. So all those people, all those great surgeons have played a role when I did my postgraduate training in general surgery. So I always give them credit because they were really, really great mentors. So in that sense, we had mentors. In another way, we didn't have mentors. Let me take it that way. So coming back to your second question, so you asked me about shocking things while I was practicing medicine. There is nothing as such that shocking. Of course, the preparation and everything, you should be prepared ahead of it. There is a lot of challenges which may happen to you. But as far as the practice of medicine is concerned, some of the things which shocked me, if I say I was shocked, would be the cultural differences. Let me give you an example. One day I had a 70 something years old guy who came to the hospital, some withdrawal symptoms and all that. And I was kind of hesitant to ask that person about his drug history. Do you take cocaine? Do you drink alcohol? Do you smoke cigarette? Because it's culturally offensive if you ask a 70 something individual in Ethiopia, right? So do you smoke cocaine, or do you do you snort cocaine, or do you inject heroin? They would find it offensive because not so many people, especially in the elderly, are drug addicts, right? So that is the situation. I don't know, things might have changed now, even in Ethiopia, because of globalization. I don't know, you never know. At least the young is doing it. That's what I hear. But that is not the culture, and it would be offensive. It would be offensive to ask about sexual history, or if you ask our mothers, our fathers about their sexual history, they might find it offensive, right? So why do you ask me this kind of weird questions? So I was kind of somehow hesitant to ask those questions, but those questions needed to be asked. And guess what? I was hesitant. I didn't ask those questions. Then my senior resident came, and he asked me if I asked him about his drug history and social history and all that, sexual history. And I said, no, it may be offensive. He said, no, there is nothing like that. come with me. We went there. He asked those questions, and the guy was not offended, and he was like, glad to share the information. Yeah, I do smoke a pack of cigarette a
Wow.
day. Of course, I mean, I do snort cocaine as well. I was shocked. What? Then, like,
You
when
mean
was the
still
last?
at 70?
Yeah. Then
Oh,
when was the last time you had cocaine? It was like the guy said about 5 days ago. Oh my God, bingo. So and the same thing, sexual history. They are not offended. In fact, like, in their 60s, 70s, if they have erectile dysfunction, they come to you, they ask you, they tell you, I have erectile dysfunction. So just give me something for ED, you know what I mean? So it's not, so those things were a little shocking for me. Oh my God. Like you were shocked right now when I told you the story. You don't expect a 70 something person to be sexually active, number one, and to use
to be
drugs and all that.
snorting.
That was something which was awkward for me, but it's a cultural difference, and you have to embrace that one. Then, since that time on, no, I'm never ashamed of asking these questions. If I think it's something relevant, I ask them, and they are happy to answer, and they don't get offended. If they don't use it, they say, "Hey, hell no, 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 no." Some of them, they will say that. Do you use heroin? No, 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 no. I've never. Even those people who use crack cocaine and all that, they would tell you, oh no, no, hell no, injection, no, I have never done it, I'll never do that. You know what I mean? There are some things which they shock them as well at the same time. But you can ask this kind of questions, they are not offended. So this was one of the things I noticed, our cultural differences, the values we give, and things like that. Other than that, to be honest with you, I'm not bragging. I'm not gonna say I'm a superhuman. I mean, practicing medicine was not really that hard, because number one, we do take care of orthopedic patients, general surgery patients, and general internal medicine patients. Okay, so we see variety of cases. So surgical cases, a majority of them, I have even performed the procedure, so it was easy. If a
Really?
comes with cholecystectomy, no, I'm telling you, in the past, I have done it. So
Oh,
it's
yeah,
not,
yeah, yeah. Mm.
I'm not talking about I did the procedure in America, but I'm telling you, if somebody comes with acute cholecystitis, this is just nothing for me. I even have taken out many gallbladders, so I know the drill. You know what I mean? What comes next? What's gonna happen next? Probably have done it open, so they're gonna do either robot assisted or they do laparoscopic, blah blah. Somebody who has fracture, the drill. You know what I mean? We had a very good exposure in orthopedic surgery when we did general surgery training, so you know what they're gonna do, what the drill would be, and things like that. So urologic cases, like ureteric stone comes, the drill. So the manifestation, blah. So I had enough experience. I'm not a novice doctor. I have been teaching. I have done a lot. So it was not that tough to practice medicine per se. And the good part is that the USMLE journey by itself will make you familiar with the US disease epidemiology, right? So step one, you study step one, that you learn the common disease entities in the US, because they focus on the most important topics, right? Step two with further strengthen it. CS would further strengthen it, and if you have done step three, will solidify it. So in that sense, I mean, practicing medicine was not as such a shocker. But if I get amazed, maybe I am amazed by the fact that you order a certain test, it gets done right away. Only few tests will take a couple of days, and that's because of the nature of the test itself. Other than that, it's just like a video game. You know what I mean? You think about a certain test, boom, you go to your electronic medical record, you order it, it's gone. The sample is taken, the result is back. So in that way, it's quite gratifying. Whatever you want to do for your patient, you can do it, and it gets done instantly, and you can help to the maximum. Medication wise, the same thing. You want to order a certain medication, it is available. If it is not available, they tell you, they order it, they will do it right away. Imaging, you can do whatever kind of imaging. It could be simple X-ray, it could be MRI, it could be CT scan, it could be PET scan, it could be nuclear scan. You name it, it is done immediately. While we were practicing in Ethiopia, of course, as a research limited nation, and you have to prioritize, resources. So that by itself could be a little bit deviation, but even then, the USMLE kind of has already made you familiar with what is being done in the ground. So it's not gonna be a new thing. Oh my God, this is done, this is done. You're not gonna say that because you already studied it, thanks to the USMLE resources. So as
Yeah,
such, there is no shocker, but maybe
that's true.
the cultural differences stand out.
Mm. So, are there any myths that you think needs to be debunked when it comes to this transition? Because a lot of people might be afraid that they might not match, like old graduate, like obviously having research recommendations. There are a lot of stuff that we hear about the USMLE journey. So, what myths need to be debunked so that people would not be worried or anxious about going through the journey?
Realities are realities, and certain things are like, a little bit exaggerated. So for example, matching could be tough. Yes, for many different reasons it could be tough, and there are certain things which might make it a little bit tough on certain individual. So obviously, for example, okay, let's see each one of them one by one. So graduation year. So if you are a fresh graduate, of course your chances will be higher than somebody who graduated 20 years ago, because if you have been practicing out there for 20 years, you have your own identity, right? As a person, as a physician, you have kind of a certain identity, and it may be difficult to reshape that identity and bring you to the place where they want you to be. You may not be trainable, you may not be flexible, you may not be ready to work with, juniors who are just immediately coming. You may have attitudes and all that. So for those reasons, institutions would prefer young, obviously. And of course, everybody wants to invest on a younger individual than an older individual. Life expectancy, I would think about how many years would this guy be practicing medicine after graduation? Maybe 10 years versus somebody who would be practicing 30, 40 years. You want to give the opportunity for that guy who would probably last longer. But the situation may not be like that. በአማርኛ እግረ ደንዳና ይሞታል ሲባል እግረ ሰላላ ይሞታል ሲባል እግረ ደንዳና ይሞታል ይባላል። When you think the frail person would die, then probably like, the person who seems fitter may perish faster. So, but humanly thinking, you want to give priority to the young. But I have seen people matching after 20 years. Last year, a good friend of mine matched after 20 years. Okay, it's a good news. Is
Wow.
it rare? It may be a rarity. Is it
Mm.
possible? Yes, it is possible. That's why he matched after 20 years, 20 or 21 years. Maybe 22 or 20 years, 23 years actually. I matched after 12 years of graduation from undergraduate. So by all criteria, I was considered as an old graduate, because once you are above the 5-year mark, they will regard you as an old graduate. So I was 12 years out of medical school, but I matched. That means it is still possible. So older graduates, don't really shut down the door on yourself. Just work hard, focus on other stuff. All right. So research, of course, research might, make you stand out better than others. Like, if you have to compare between individuals who have research experience versus somebody who has never done research, I would give a priority for someone who has the idea. Because when you are in training, you are also required to do some scholarly activities. Okay. It could be a poster presentation, research publication, or seminar presentation, things of that sort. So if you are experienced, you will stand out. So it will help you. But the fact that you haven't published anything doesn't mean that you're not gonna match at all. There is nothing like that. Okay. That is number two. And number three, what was the other thing you mentioned among the
Recommendations, networking, and things like
recommendations? Yeah. Recommendations, as far as recommendations are concerned, many people miss the point. So when somebody writes a recommendation letter for you, it is a testimony. For example, if I have to write a recommendation letter for you, Dr. Anania, how do I know you? What kind of personality are you? How great a physician you are? Academically, how accomplished you are? I am testifying, saying that she is one of the best in terms of personality, in terms of achievements, in terms of scholarly activities, academic achievements, all rounded kind of things. So if you find somebody who can testify in the best way possible, in a personalized manner, not just a generic recommendation letter which you give for everybody. Oh, I know Mr. Blah blah blah, Mr. Blah blah like this.
Yeah, yeah,
That's not gonna go anywhere. It has to be a personalized letter. So if somebody, whether they are located in Japan or in Korea or in Africa, in Ethiopia or in America, if you got somebody who would testify in the best way possible, somebody who dedicates his time to write you a personalized letter, that is what will help you. So people assume if somebody sitting in America writes a letter would grant you a chance. That is not true. I think you should change this attitude. So find someone who will testify in the best way possible. And sometimes it needs to make sense. Some people can come to me and ask me to write them a letter. If I don't know them, I have to be honest with them. I'm not gonna write a letter for you. Number one, I'm being a fraud. I'm lying, and I don't want to hurt my conscience. And number two, it is not right. Number three, it is illegal. And number four, it's not right. It's not morally correct and all that. So I want to help you, but not in this way. I can guide you what to do. I can give you other informations, but
yeah.
don't ask me to lie. I don't know you. I don't know you. If I don't know you, I shouldn't write a letter for you
That's
because
true.
I'm not going to help you. And people would ask you how you know me, actually. People do not know that the recommendation letters are not going to sit in front of the program director. They will ask you about that later, especially if it is a very beautiful letter written from someone. They will ask you, how do you know this person? How did you work with him? With what capacity? Where did you work? Where does this person know you? In which institution? When? The timeline? All this question will come after you, by the way. Like, if there is a beautiful letter in
Interview.
front of them.
Mm.
So if I am lying, you are lying, you can't even defend
Mm.
yourself and you will be caught, you know. I am in America. The people know that I have been practicing in America. I've been here for almost 10 years. And then you just graduated yesterday and you are telling them, Dr. Fakadesilasse, and you are telling them Fakadesilasse knows you and he's writing a testimony about you. They will figure it out, you know.
Yeah.
So there will be consequences. So not only that, try to find a great person who worked with you, who mentored you, who knows you well. Don't worry about the geography. Try to get a personalized, excellent letter. That's what you should do. So this has to come out of the mind of many people. If you had the privilege to work with a US based physician and that person knows you very well and he writes a letter for you, it could be a plus. It doesn't harm you, you know. But if that is not the case, don't try to force people to write a false letter for you. Don't do that. It's a big turn off for me as well, because some people, they come, they ask you, when you tell them you cannot do that, then they offend you sometimes, you know what I
Mm.
mean, with
Mm.
their response, or they just ignore you. They don't even respond back saying, thank you, I appreciate that, I understand that, I'll try to find somebody else. You should say that. You ask me to write a letter and I'm giving you an answer why it is not right, and what the reason, if I am mentioning the reason why I'm not doing it to you, you should acknowledge you got the message by saying, I do understand that, I thought it was possible, but it makes sense, you are right, I'll try to find another person, but I want you to help me with this, with things which I can still help them. But some people, they just ignore you and disappear. That's not nice. And
Mm.
that's not respectful as well. You know what I mean? They ask
Yeah.
you to lie and they get offended when you tell them you can't do that. So don't do that, guys. Don't offend people who can potentially help you. Okay,
Yeah. That's a
that's it.
good advice.
Any other thing? Any other thing you
Yeah,
want?
that's a good advice. No, when you're talking about that, something came to my mind because one of my close family members is actually going through the USMLE process, and he was doing like an internship at a place to get the recommendation later.
Mhm.
So is that something possible to do? And if someone doesn't know how to get those opportunities, what would you recommend because you understand the system?
I hear about such things. I mean, I think there are certain virtual opportunities where people can pay money and get enrolled, and they do some scholarly activities together with those people. And sometimes I think they discuss cases virtually. I have no idea. In that sense, some people might promise them to write them a recommendation letter by the end of the this virtual attachment. I hear about those things, but I do not have a first-hand experience. So people can explore those opportunities. That's a lot of money. I think, I don't know, would that really help them achieve their goal? Maybe yes, maybe not. So you have to think twice. Is it an investment which you should really do? Because, like, if you have to pay $1,000 for a virtual rotation, just for the sake of getting one recommendation letter, that recommendation letter may not have the weight of an actual observership or apparentship, then it's a waste of money. Just invest it on something else rather than, like, throwing your money to these people who are claiming they will write a letter. I don't know only God knows what kind of recommendation letter they will end up writing for you at the same time. They may simply write a generic letter for everyone, and that's not going to be useful as such. You know what I mean? So you have to think twice. I do not have a first-hand experience. But if you are physically in the US, you can always, I have done shadowing with certain individuals. I was fortunate, to be honest. So one of the women physician whom I shadowed, she's an attending physician at John Hopkins University. So I get the privilege to go to John Hopkins. I was living in Virginia at that time, so yeah, I have to drive almost an hour and a half to Baltimore, but it's okay. I had to do it for a certain period of time, and she wrote me a recommendation letter. And another person who practices in Howard University in DC also wrote me a recommendation letter. I worked with them for a certain period of time. I never asked a person with whom I have zero connection to write me a recommendation letter. And some of the people who wrote me the letter were those individuals who know me in Ethiopia, but they are Americans. So I mentioned about the clinical research methods I did with University of California, San Diego, right? So these individuals were world-class ID physicians, highly respected, highly known, especially in HIV medicine. So one of the professors, he was more than happy to write a letter for me. I am more than happy. And actually, I was asking about that professor in one of the institutes. Where do you know Professor Matthew? Because he is well known in the US.
Wow.
So
Yeah.
they saw the letter. He wrote a good letter. He said, like, I waived my rights. So I never saw the content of the letter. But he told me, Fakade, I know you very well, and I am going to write a strong letter. That's the only thing he said. And I think, in fact, he did. And he didn't exaggerate. They don't exaggerate. They don't lie. They just tell what they know about you. Because it's your name, by the way. When you are, like, writing a testimony, sign it and send it, then I am responsible for all the words I put in that letter. So they don't joke around. So one of the program directors asked me, where do you know Professor Matthew? Because he's from University of California, San Diego, and I am originally from Ethiopia, and the majority of my training is in Ethiopia. So he wanted to connect the dots, and I told him, University of California, San Diego was running this 2 years course in clinical research methods for us, and I was part of that group, and he was my teacher, he was my mentor. Okay, yeah. So then I knew that guy has already written a good letter for me, indirectly at least. You know what I mean?
Yeah.
So if you worked with some capacity somewhere, it could be when they were visiting, doing some missions in Ethiopia, or some people who had been to Black Lion or wherever you are working, and you worked with them, they can write later because they know you to a certain extent. One of the letter writer was one of my students, by the way, because this guy is from America. He's Ethiopian originally.
Wow.
He's Ethiopian,
Okay.
but he did his medical school in America, and he is by the time he came to Ethiopia, someone introduced him to us, and I love teaching, as you know, maybe I don't know. I love teaching, and I'm
Yeah.
passionate in teaching. And somebody is interested, I pay the maximum I do whatever I can to help those people. So this guy was very interested to come to the OR with us and everything. So he assisted us during surgery and all that. So he knows me very well. I taught him when he was in Ethiopia. So I asked him to write a letter for me. Then he wrote a very interesting letter for me. So those kind of things can still happen. But virtual, I don't know. But if you are physically here, try to find a physician who is willing to take you to their service. You can shadow with them. At the end of the day, they can write a letter. So without doing that, don't ask people to write a letter, please. Most people do not like it. I'm being honest.
Yeah, that's great. Thank you for the great advice. I think it's going to help a lot of people and clear out a lot of confusion.
Yeah.
So you are big on social media. I mean, you have quite a following for many different reasons. Because, well, people knew you as their teachers when you were in Ethiopia, and you were a great surgeon. Whether somebody's trained under you or not, people know your name. You are quite well celebrated and recognized in Ethiopia, but also now after you've moved to the US, you still continued that work and you do a lot of social media engagement. So, what do you think could be the role of social media in the career of a physician? You might not necessarily be doing it to, get recruit patients or whatever, but what role can it have other than that? And then what are ethical issues that we need to consider when we're using social media?
Social media is quite interesting, by the way. It's one of my favorite activities these days. It gets me entertained to a certain extent, and I love what I do on social media.